Well, area hospitals are seeing a dramatic increase in the number of hospitalizations related to coronavirus. Good evening. I'm Katie Orth.
And I'm Eddie Flores. Big 2's Gian Kim checked in with local health officials to see how they're handling this influx of hospital patients. Good evening, Gian.
Well, good evening to you guys as well. Well, the good news is, guys, all three hospitals have it under control right now. The bad news is the uncertainty as we head into the future. Now, Medical Center Hospital tells me the situation is ever changing, and it's changing by the minute.
You never know what's going to walk in those doors.
Ector County is closing out the week with 227 new cases Friday, the largest two-day jump the county's seen thus far.
It's something that we just don't know what to expect, except to expect the unexpected and expect the numbers to keep going up, unfortunately.
Numbers changing dramatically just from morning to afternoon. For every 4 discharges, there's 4 new admissions.
As of one point yesterday, we were at 51, so that's a lot of COVID patients in-house, considering you look at just a month ago, we were only at somewhere between 10 to 15.
Staff at Medical Center Hospital are now flipping the outpatient surgery center into a COVID unit, following Governor Abbott's decision to postpone elective surgeries. As of now, Medical Center Hospital has the capacity to prepare 98 COVID beds in total. Of them, 44 are already filled. Trevor Tankersley with Medical Center Hospital says staff are feeling the pinch as 30 to 40 personnel are out for self-quarantine and counting.
We're consistently seeing COVID patients come in-house, and there's really no end in sight. So I'm sure it's weighing very, very strongly on their hearts and their minds.
A sentiment Dr. Sarah Vannon with Odessa Regional Medical Center echoes.
Everybody's working really hard, and you can see it take a toll, like physically on them, draining them at the end of their shift.
ORMC is working to open up new beds for COVID-19 in phases. By the end of phase 2, the hospital will provide 55 beds in total, 17 of which are filled.
It's kind of a double whammy in the fact that not only are we having surge capacity with the patients, but then we're also losing staff to potential, sickness or having to be out for quarantine.
And in Midland, a similar concern on staffing. Midland Memorial has the capacity to provide 137 beds for COVID-19 patients, 38 of which are filled. And while medical resources are plenty, they lack the manpower.
We have staff that aren't necessarily critical care nurses, but they can come in and help assist a critical care nurse, so that expands a little bit of their capacity. We are also looking at contract labor, bringing in folks from out of state.
Now, Tankersley also told me that doctors here at MCH are worried about the backlog for elective surgeries for when they do resume. Now, it's important for all of us to remember that all 3 of these hospitals are fighting COVID-19 alongside taking care of patients that have no relation to this virus at all. Reporting live in Odessa, I'm Gian Kim, Big 2 News.